Q&A session. Anybody who has any question or any doubt or anything that you want to ask me, please feel free. Oh, so good at the presentation, very clear.
No question.
Perfect.
So the question is any side effects. There is no. Have you played the flute before or any musical instrument?
Yeah.
The low laser therapy is supposed to be as safe as playing a musical instrument. Yeah. So it's actually very, very safe. It can be used to treat almost any kind of condition, to help benefit and improve the outcome of almost any kind of condition. Of course, in some instances, like people who have, for example, active cancer, we don't generally recommend when they are undergoing chemo or radiotherapy to use it during the active phase, or when they are actively taking the chemo or radiotherapy. We don't encourage. Maybe to wait about 2 weeks to a month after that, because it might coincide with the treatment. And also people who have organ transplant, after they have transplanted a kidney or transplanted an organ, we don't recommend. Small children, yes, there have been testimony of people more than 6 months, patients more than 6 months old who have used it. Go with caution and use it on a lower bar, but it's not going to cause any damage. It cannot. The laser is not in a potential to damage anything. It cannot damage anything. Yeah, so very safe, very, very safe device. Very good for allergy. Just now for the free radical, all the oxidative stress disease, allergy is one of them. So for allergy, patients who have allergy, some patients, they will see the skin specialist many, many times, and then they will take this antihistamine like Piriton, Zyrtec. They keep on taking, and all that is just treating on the symptomatic, but does not give a cellular change. This one can actually give a cellular change. Of course, each person, the result will vary. Some people will achieve faster results, some will take longer time to achieve the result, but it will definitely help to reduce the allergy itch, yeah, on a long-term basis.
How long? Is it half an hour?
The recommended time to use it per day is half an hour twice a day.
For the kids or for the 9 years old children?
9-year-old children can use half an hour twice a day, no problem. Yes.
Once
They can start off with a lower intensity. They can use 1 bar, 2 bar for 10-20 minutes, then slowly step up accordingly. Let the body detox. Any allergy produce something called histamine. So you don't want to wash up the histamine too quickly, because sometimes you can make it more itchy initially. So you have to start off a bit more gradual and then hydrate, and then it will clear. Just like when we detox, when you take a detox, for example, like you go to pharmacy, you buy a detox, the toxin has to come out somewhere. So that's why you have to hydrate and take gradually.
once a day.
You can start off with once a day, then slowly increase. But twice a day once they're already used to it, twice a day, half an hour, no problem.
What about 5 years old?
No problem also. Can use, but can use at a lower intensity, 2 bar.
Thank you, doctor.
And cold laser, any help to the person, kids with autism?
Yes, regarding children with autism, there has been research conducted on cold laser, using cold laser for ADHD, for autism. There has been very good studies, because it helps with the neuronal part, the brain. So the synapse in the brain, the connection between the brain is actually linked to autism. But of course, combination therapy with a few other modalities might be able to achieve faster results. So they have like a behavioral therapy and a few other therapies also. Combination should be able to give a good result, but you have to use the nose piece. Yeah.
Some of my clients, they have improved a lot using the laser device, especially for the diabetic clients, but there are two who insisted that it did not work for them. So I'm wondering why.
A lot of people, if you ask those people who are distributing the laser device to many patients, they will tell you that one of the main factors is you have to ask the patient about their compliance. Compliance means whether or not they are actually using it in the correct method and whether they're using it regularly. A lot of people will shortcut because sometimes they are rushing for time or they feel like a commitment, like they have other things and then they might not use the nose piece. Actually, the nose piece is which stimulate the stem cells, and very close, the nose has a lot of stem cell and that one will stimulate the brain. So a lot of disease actually is linked to the brain, and the brain control all the pathways. For example, the pain pathway and the pathway for certain disease and everything is linked to the brain. So you have to ask them, are you really using the nose piece? And you have to check with them, and you have to give it about a 90-day period plus minus for them to get any substantial benefit. So ask them to compare. Of course, they will have to also, they just chinchai go and eat everything and really enjoy it, then it's not going to work, because that is going to, a lot of people think that they have a blanket when they are taking this kind of treatment, then they won't follow a proper diet regime or proper lifestyle regime. If they do like that, then they will not achieve a good result.
Doctor, have you ever made the cerebral palsy?
One moment. You're in the mic.
Yes, doctor. I would like to ask how about the cerebral palsy. Has this testimony or cases before? How helped for this disease?
There have been instances where one of the main issue with cerebral palsy is the tone of the muscle tone. So there have been instances where the muscle tone, of course, to say completely recover from cerebral palsy is very difficult, because cerebral palsy is something which is genetic and it's quite difficult to treat completely or cure completely from, since it's also a birth-related condition. So it does help to reduce the muscle tone. That means the spasticity, the stiffness of the muscles and the limbs, and to a certain extent also the cerebral function of the brain can help to improve, yes. But sometimes, like I said, for those diseases which are more chronic, more severe, the time to see the benefit might take a bit more longer. So you might have to appreciate to be more consistent. And again, you have to use the nose piece for cerebral palsy. Especially this neurological related condition, the nose piece is very important.
Good morning. Okay. My member got this call. I don't know what was the disease, because this one is a nerve problem.
Okay.
This call trigeminal
Neuralgia.
neuralgia.
Okay.
So is it our co-laser can have this kind of disease?
Actually, very good for trigeminal neuralgia. According to the studies, cold laser therapy, they have a big book on laser therapy.
Okay.
That book is, I think, about 400 pages. So there they have all the research done on laser therapy, and you can see the pictures there. The patient's face is quite badly affected by the trigeminal neuralgia. After using it for, I think, 2 to 3 weeks, they already started to see improvement. Yeah, but of course it will vary. The duration of recovery will vary from person to person.
So of course have to use this one.
Have to use the nose piece. Very, very important to use the nose
Okay,
piece.
thank you very much. One more question. So I got a friend also got high blood pressure. After using the pressure shoot very high. Why is I have no idea.
Did he check the machine with the digital machine or manual machine? Any idea?
This is my customer.
Okay.
It's just that first time when she used it for the first time, and coincident she went for blood test and do the doctor's check. It's the doctor device shoot up to 220, which is never been that. So she called me and she was in panic. So why is that so? And some of my customers, the high blood pressure cannot maintain. It's like zigzag like that. Why is that? So I think I know it's under the process. So why is that? So I have to explain to customer. Otherwise, they were in panic. Yeah. Thank you.
So going up to 220 is very high, and it might be linked to other things, like the person might have a bit of anxiety or nervousness, and maybe some people have something called white coat syndrome. White coat syndrome means when they go to see the doctor, automatic they panic. And when they panic, the pressure will go up. So this may be one of the reasons. I'm not sure about specifically for your client or your customer, but maybe what is happening also is sometimes in chronic disease like diabetes, high blood pressure is chronic disease. Chronic disease means long-term disease. So when they are going through the initial period of using the device, there's something called a healing crisis. Healing crisis or acute phase. So acute phase is actually a healing process. It's part of the healing process that as the healing process is taking place, a chronic disease which is already long-term stuck for many years, not improving, will go through sudden changes because the body hasn't been altered for a long time. When it goes through this alteration, there can be some fluctuation, but usually temporary. Best advice is you ask them to reduce the intensity, use a lower bar and lower time, maybe 2 bar, 20 minutes, continue using the device, and then slowly increase up once the pressure has stabilized.
Yeah.
Morning, doctor. I have a question to you, doctor here.
Oh, over there.
Okay, sorry. My friend was one a doctor. She was during birth already. Come up allergic to a lot of foods. Then doing the blood test, more than 1,002 types of foods. Then what I understand now, because quite some time already, she told me that the doctor cannot take bread, cannot take cake, all those type of things. And then she only can take vegetable, chicken, I think more to allergic to carbohydrate or something like that. So all along the doctor's skin with having rashes all over the body. Then I think now the doctor also is from 3 or from 4 already. Think about the daughter when at the age of 12 years old, 26, we see a doctor who prescribed her with probiotic. From then on, the condition improved a lot, but still, it did have improvement, but then the thing is still going on. It seems birth is like that. So I was thinking, is that medical laser therapy, can it be helped? I think it's a bit different from just now the question there. Then one of my colleagues, I also recently I found that the doctor also allergic, but different type of thing. The doctor can only take organic food. Other than organic food, he cannot take. Also same thing, we're having rashes all over the body. So I'm wondering whether this can help or not.
It's a good question. Actually, there's 2 ways to treat this if you want to approach this kind of a concept. One treatment is like what I was saying, in the future, more people start to use the laser device for laser therapy. A lot of these, if you look back maybe 50 years to 100 years ago, right? How many children used to have allergic problem and sometimes even this autism, ADHD, and all. It was not so common. But now it is so common that even the pediatric specialists, the brain specialists, they have to divide to a separate section for the autism and ADHD because there's too many of these patients, they cannot manage. So now they have child behavioral specialists also to manage because it's considered a separate expansion of the pediatric brain specialist center. So what I'm trying to say is that a lot of the change can be on a preventive scale if the person can do the antioxidant and free radical prevention pre-pregnancy to prevent. And then during the pregnancy also, we don't essentially recommend, not that it's dangerous, but we just don't essentially recommend to use during pregnancy, but they can lead a healthy lifestyle, eat healthy foods, and sleep early, do regular exercise, drink lots of water during the pregnancy period. And this I'm explaining is more on a preventive, like to address your question. Now for therapeutic to treat the condition after already being diagnosed, probiotic is very essential, and there's so many strain of probiotic available in the market. So they have to use a very powerful probiotic which is suitable for the child, and use the correct strain of probiotic for the child, which will help, because this is actually essentially a digestive problem. What you're talking about is actually intolerance. They're having an intolerance, and that is leading to the skin problems. It's actually, if you apply lotion, cream, and all these things, it's only treating on the surface. We need to treat the digestive system internally to repair the cell, because the gut is leaking, and this is where cold laser therapy can help to repair the membrane of the digestive system. So the correct place is the child can use targeted therapy over the abdomen. There's actually 4 areas in Chinese medicine which is the very powerful acupuncture point. What ion laser is actually recommending is the Nuguan point. The Nuguan point is at the wrist, about 3 finger breadth from the wrist between the 2 tendons. So the Nuguan point is actually the gateway to our heart and for our blood circulation, which is one of the most important points in terms of acupuncture. So that's how it works through the meridian to repair and increase our function of the laser. In fact, they have done study, if you go for conventional acupuncture, compared to this acupuncture, which is acupuncture combined with laser therapy, the effect of the acupuncture is 50 times more. 50 times more. So it's very significant difference combining the laser with the acupuncture. Now there's other area called Higu and Guanyan and Juzandi. So the digestive system is very close to the Guanyan center. So that is more to the navel, about 2 fingers below the navel. So this is actually where they should do targeted therapy on the digestive system at a low intensity. Maybe start off 1 bar, 10 minutes, then slowly increase to 2 bar, 10 minutes, combined with a few other therapy, which will also include probiotic. There's something called desensitization, where some certain pediatric who are specialized in allergy, they will introduce small amount of the allergy to the patient in small doses over a course of maybe 1 to 4 years long. And this will help to sensitize the person to what is the allergy. But it's a very tedious process. Every week have to go to see the doctor. So if that is not convenient, use the laser therapy with the probiotic.
Just now the one that you mentioned, that means to say that beside the normal treatment,
Beside the normal one, we can do the targeted treatment, is it?
Yes, yes. Targeted treatment to the digestive system, to repair the digestive system.
But also need to do the basic type also, is it, for the kids?
Yes, can do both. Combination will work better.
Thank you. What about kids like that?
Wait. No, mic.
Nutrition. What about, we are doing this cold laser, I believe. We are doing this cold laser, I believe. But what about nutrition to put in for our daily? Every minute our body is working.
Yep.
So how is it about?
I didn't get your question.
Okay, we are doing this therapy, and then for under control. And what about nutrition to eat?
So,
any
your
particular
diet to eat?
for the children?
Char kway teow and wanton mee. Malaysian diet high in carbohydrate. So you got to have a balanced diet. There are a lot of diet fad, ketogenic diet, this diet, that diet. Just go for a balanced diet. Yeah, you got to enjoy life also. Go for a balanced diet. Eat a little bit of carb, a little bit of protein, a little bit of fat. And then, once in a while have your cheat meal, enjoy also. But if you really want to maximize the potential, you eat a very nutritious diet, high in fruits, high in fiber. Of course, the absorption is very much more better, and you will see much quicker result. Like those people who have more serious disease, if they use the laser therapy with a very good diet, like she was saying just now, like an organic diet, for example, very low in pesticide, and then good quality water, alkaline-based water, or a combination of good quality water with good food and the laser device, you should be able to achieve faster results.
Okay, my son-in-law, about 40 years old, she was 4 weeks, I was struggling with these vegetables. Only plain water with vegetables. So only vegetable like some, then okay. So I blend with some, pumpkin and carrot to make it a bit of taste. So she will be struggling this for 4 weeks. Because the doctor said she had the gastric, the acid. First they was treating him gastric and then certainly very pain 3 weeks ago. And then he went to admit the hospital and they checked out all this tube and all that. And it seems like the gas is bubbling up. So he was all 4 weeks this up. But no oil, no salt, just plain water and vegetable and a bit of rice. So then they said, hey, I came here, I don't know what's about here. And then what he do is they went to check up, I don't know what's the result now. So without salt and without oil for 4 weeks, just plain water and vegetable and a bit of rice. Of course he did 7 apples per day. Too much or not? I think it's
The doctor recommended this diet?
No, she was thinking that to clear out the bubble. So I'm very down when I'm doing things.
I would recommend a well-balanced diet. Well-balanced diet, a little bit of mix of everything. But diet will be according to what the health condition is. Yeah.
So detox lah.
Okay. Yeah. Linda.
This is a 3R laser. So 3R laser, there is a risk if you directly apply it directly to the eye.
Also
just like the
kind
laser
of
pointer that
question.
I was using just now also.
So many questions.
I don't think, unless a child is doing it, I don't think anybody will intentionally put it at the eye directly. So wouldn't encourage, but I don't think it's definitely encouraged to do something like that. But if at all, according to the studies, the damage is only temporary. Maybe there will be only some minor blurring of vision, and usually it will be corrected back after that.
Time's up again.
Doctor, what about glaucoma and retinal detachment? To what extent the cold laser will be able to help? Thank you.
So I've used the laser device for retinal detachment and got pretty good result, but sometimes the retinal detachment is different stages. So the more advanced stage, if it's very severe, definitely they will need to consider for surgery. So combination therapy normally works best. Do the treatment that the doctor recommend. Use this as an adjunct in support for the retinal detachment. Glaucoma as well. Yes. Support, that means you don't totally stop the eye drops that doctor prescribed for you for glaucoma. Continue the treatment that the doctor prescribed. Use this as an add-on therapy.
Yes, doctor.
I have 2 questions here. Can cold laser therapy help skin disease called pemphigus vulgaris related to autoimmune disease? Second question, can we use 2 or 3 units of cold laser to target on different parts of the body?
Who is this person want to do 2, 3? Want to save time, is it? Or lot of health problem? Okay, never mind. You can. There's no studies. Like if you brush your teeth 10 times a day, or you brush your teeth 2 times a day, I'm not sure if there's any benefit brushing your teeth 10 times a day. So you can try to just use it according to what they prescribe, because that is what the clinical study is based on. So the clinical study is based on using, you can use the device even 4-5 times a day also, but targeted therapy normally I don't recommend more than 2 times a day, more than 2 sessions, yeah. Targeted, you're talking about targeted therapy? Yeah, so targeted therapy not more than two sessions in a day.
But if
why do you need to over-treat your body? If you take blood pressure medicine 3 times a day, does it mean your blood pressure will be better controlled as comparing to taking your blood pressure once a day? So over medicating doesn't mean that you're going to get a better benefit.
What about if, let's say, pain management? Is it okay to use few times per day? For pain management?
For pain management, targeted therapy,
Yes, correct.
no clinical study proven that it's going to give you better relief by using it multiple times a day, but this is on a personal level. What I can recommend to you is on a clinical level. Clinical level means what research has been done. So you can have personal opinion where people say, oh, I use 5 times a day, oh, fantastic, a whole year, 1 day already recover. But this one is depending on each individual. So of course, as I said, it's generally quite safe and shouldn't have any issue, but if you overuse it, also you may not get any benefit, or you may get benefit, but this is an individual basis.
People with cataract operation, can you use it? One question.
Okay.
Second question, there's this lady, she had an eye transplant. Somebody donated a cornea for her. So she's afraid that it may damage that cornea, which is so difficult to get, to have it transplanted. So she's so afraid that it may spoil the cornea, which has been donated. What do you think? Can
Yes,
she use
any form of organ transplant, there is an adaptation for the body to adapt to somebody else's organ. So, for example, somebody who takes a kidney from somebody else, they have to take certain medication to keep their immune system down. So this is actually improving the immune system. Then you take something that is counteracting with the laser device. It's not recommended. So not recommended for any form of organ transplant. Cataract off can.
Doctor, for 80 over years woman, she has a very sort of weak heart, and then I think she has a valve or something. Do you advise her? Can you advise whether she can use eye laser?
80-year-old lady with a weak heart.
The doctor says she has a weak heart, so she go back for checkup quite regularly. So it has a valve, something like that. Connected.
Is it a pacemaker? The battery
Your battery more. She didn't. I only know that she has a valve connected to the heart, so she has to go back for very regular checkup. So
You ask her if she wants to live until 100 years old.
Yeah.
She can visit. Safe. Everybody is safe 6 months above to 150 years old.
Doctor. Answer to my first question.
Wait, just hold on 1 second. I just want to check the time because
Still got time, it's okay. Still got time.
So just now I asked about the skin disease, pemphigus vulgaris, related to autoimmune disease.
pemphigus, yes. Pemphigus can, autoimmune condition can, but start slow because